So I'm Dr. Shruti Sankpal. I'm a master's in homeopathy. It's been more than 20 years that I have been in the field of homeopathy. How many of you have heard of homeopathy? Let's start with that. Yes, I know you people have heard. In general, how many of you know that there is a medicine called homeopathy that exists? So in India, it is the second best practiced medicine. And it also has the same sources like Ayurveda. We usually have the sources coming from minerals. We have sources coming from plants. We have different sources. But when it comes to homeopathy, Kenya has not been aware of this practice because it was not introduced. But I remember in 2017 when we landed in Kenya, there was a school called Integrated Science of Medicine, which was running in Kwale. It was run by Richard Pitt. He's still active here, and he has trained more than 100 children with a diploma course of homeopathy. So homeopathy is not just a science where you get to learn about medicines and then you apply only on the diseased people. Homeopathy is more of a holistic science where we try to focus on the balance of your body, mind and soul. Just to be precise, as you all are pharmacy students, I want someone to tell me what is the definition of health. Let's start from a basic. What is the definition of health? Anyone, just be proactive and just tell me what is the definition of health. I don't want this session to be me only talking. It will be an interactive session so that we all are on the same page and we are here to learn something that you can include in your day-to-day routine. So anybody, yes? That's the perfect answer. Physical, emotional and mental well-being. How many of you really focus on that? How many? None of us, right? Right now also nobody is focusing on their mental health. Everybody is like, oh, I have to sit here and I have to attend this session for 1 hour, right? Let's be honest. I've been a student. I've been on those chairs and even I have heard lecturers giving us session. So can we have that clear that we are going to be friends here? Not that I'm a lecturer here, so you have to respect me and then listen only to what I say. I want that to be like interactive one where you can ask me questions and we are here to educate you on this system of medicine. So this is complementary medicine, which we call homeopathy. The first important thing, the word complementary itself means that we are not diverting you from the mainstream medicine. Conventional medicine exists and it will still play a key role in our lives. Reason being, it is used for acute conditions, it's used for chronic conditions. But there are times when you need extra care, right? For example, if you're lying in your bed, you're taking all the medicines, yet you are not recovering, right? You have seen patients, correct? In spite of giving the right treatment, in spite of being there in the hospital with the experts, yet the patient is not recovering. Have you tried questioning yourself why? Have you? Because the patient needs a little bit of extra care now, a complementary care. There, that time is when we step in giving you complementary care, where we are trying to escalate the recovery along with conventional medicine. So today we will be discussing of how as complementary medicine, we can stand along with conventional practitioners, so we give them a holistic recovery. Are we together? Okay. So now what is homeopathy? That is the first question everybody is having, right? So homeopathy is one of those medical specialties which carries no penalties. It has only benefits. Now you will ask why only benefits, why there are no penalties. The reason being it's completely natural. It comes from sources like plants, minerals, which actually help our body to balance. And hence we say that it doesn't have any side effects. If you never try, you will never know. How many of you here have tried alternative medicine? I'm not going to say homeopathy because it is new. How many of you have tried alternative medicine? May it be Ayurveda, may it be the Chinese medicine traditional. How many of you have tried? Just be honest. You have tried? Yes, good. Let's start with Ermias. Like, what was your experience when you tried complementary or alternative medicine? What was your take on it?
Sometimes some of the I have tried herbals.
Herbals is also okay.
Options, maybe the tastes
Mm-hmm.
would be the problem.
Taste could be the problem. That is one good thing. Yes, your experience.
I'm also saying the taste is a problem.
Mm-hmm.
And then sometimes the way it's taken, like it's normally taken orally like all the time. So
Mm-hmm.
if you don't prefer oral,
You don't prefer oral, so you want an injectable.
yeah, like most of them are oral.
Okay. So one important thing that you mentioned, when it comes to complementary medicine or traditional medicine, many times acupuncture, those are just invaded, like what do we say? It is pinched, not to a level where it will interfere with the other actions. When it comes to complementary medicine, we are majority times non-invasive. We don't want patient to feel the pain. That is the only reason we are called complementary, because we are trying to take away the pain what the patient is having when they take the conventional medicines. Okay. If there is any query, just ask me there itself. Okay. So homeopathy was developed in 1796 by Dr. Samuel Hahnemann. And why was it invented? Because he was dissatisfied with the aggressive medical practices like bloodletting and toxic dosing common in his era. During the 17th century and the 18th century, people used to feel like removing the blood from the body will make them better, because they felt that the blood was poisoned. Because that time there were theories that made them feel that this is the right way of treating them, because there was no enough knowledge of how the treatment should be. So what is the meaning of homeopathy? That is, homeo is similar and pathy is suffering. So the basic idea is like cures like. What has the capacity to make you unwell has the capacity to treat you as well. So example, onion causes watery eyes. Has anybody here never cut an onion?
Yes,
You have not cut an onion?
I did.
That's what I'm saying. Like I did it in another way. So everybody has cut onions, right? When you cut an onion, you do what? You have watery eyes, right? You also have watery nose, correct? So in homeopathy, what they did was they used the onion as a source, they diluted it and made sure that they used it for complaints like, example, if you can give. When do we have watery eyes and runny nose? Perfect. So they used that in a potentized form and they found results with it. That is how homeopathy started. Now, for example, think about the COVID vaccine. How many of you have taken the COVID vaccine? Everybody, yeah? Did you know how it was made? Anybody? You know, yeah? It was made right from the person who was infected, right? Correct? If I'm wrong, you tell me. Isn't it the same thing? Like they gave the virus to a healthy person, antibodies were created, and from that, they created a vaccine. What do you think that principle was? Creating a same disease, getting those antibodies to be given to people so that they create more antibodies and your immunity is built stronger, so that if you're getting infected, you will not be going to that fatal stage. That doesn't mean that the vaccine is completely working. In spite of us taking vaccine, we are still facing those issues, right? People are still having COVID, correct? So this is just a base that I tried to share, like how homeopathy works. It has a similar concept of like cures like, and we already are surviving with that one after taking the COVID vaccine. So a little bit of history of homeopathy, how it came into existence. So Samuel Hahnemann, he was a assistant to another physician called Cullen, and he was working as an assistant because he wanted to know how the conventional medicines are working on individuals. When he was working, he realized that when the medicines were given to the patients came up with more other symptoms. Say, for example, in general, whenever we take any antibiotic, what is the first thing that the doctor recommends you to take along with that? An antacid, correct? Why? Because you tend to suffer from acidity when you take antibiotics because they are quite harder. So when Samuel Hahnemann was learning all these things, he realized that we are giving patients relief at the cost of some other suffering. And that is when he induced himself with a cinchona bark. Anybody of you here is aware of that cinchona bark? Yes, it's a plant. And when he took it, he got to know that he was developing symptoms related to malaria. Similar symptoms. The reason being the cinchona bark has quinine properties. You all know about quinine, right? Imagine if you're taking a quinine on a healthy body, will it not give you symptoms? It will give you symptoms, yeah? Because you're putting a little bit of that source in your body to develop it. And that is how Samuel Hahnemann realized if we are able to give a similar picture in a diseased body, the action will help to recover it. That was the philosophy when homeopathy came into existence. So he hypothesized that substances that produce symptoms in healthy individuals can treat similar symptoms in a sick individual. Unlike the conventional pharmacology, which uses opposite action, that we all know. Like if I'm having a fever, what will I take? I'll just take an antipyretic so that my fever levels go down. But in homeopathy, Hahnemann was able to develop biochemic medicines which has a combination of iron and phosphorus. So if you see the properties of iron and phosphorus, what does it do? It increases the heat level in your body, right? In general also. So that is how he introduced this concept of creating similar disease picture in a diseased body so that both can work together and get rid of it. How many of you know the theory of like repels like? Opposites attract each other, correct? And like repels like. Was my voice audible, or you need me to have a mic? Hello? With a mic is better? Okay. So how many of you know like repels like? Everybody has studied physics here, yeah? So imagine if we are able to do the same theory in our body of having a like and a like together and repelling it without having any invasive treatment. Will you be happy? Yes? Do I play some music because you people are going to sleep now, I feel? Okay. So when it comes to homeopathy, we have few principles that we usually follow. These principles are not only related to your body, but it is related to the medicines or to the herbs that you use. First is law of similia. We all studied that, right? Like cures like. So don't try to go and do something without any knowledge. Like, okay, if I've got a hangover, then I'm going to have more next day and have a more hangover so that I'm feeling better, right? What do you do when you have a hangover? Pardon me? I want an answer. What do you do when you have a hangover? I can't hear you, please. Be loud. I think Armias is the only one who wants to answer me.
Not what I did, but I know I know what my friends used to say. When you have hangover, you drink alcohol, so it cancels out.
Yeah. But I'm not going to say that because the students will not come to the college or school next day, yeah?
No. The good thing is you is non-alcoholic.
Yes.
Don't drink alcohol.
Oh my goodness, the reaction was quite surprising for me. No worries. Okay. You are asked to take caffeine, right? If you see the properties of caffeine, you will get to know why it balances and keeps you sane after a hangover. That you will have to go and study. Okay. Second law is law of simplex, which is called a single remedy. So in homeopathy, we don't give you multiple medicines if you are coming to us with any condition. We try to find out what is the root cause of your complaints, why it is happening to you, when it is happening to you, because that's the holistic approach that we are focusing on. And we try to give you a single remedy so that your immunity creates an environment for it to act. So that is the law of single remedy. Third is law of minimum. How many of you believe that your body's immunity is more stronger than any other medicine that you take? Yes, our immunity is the strongest, just that we don't allow our immunity to get into action and work for us. So when you give a minimum dose, when we say that we give you a minimum dose, the reason we say it, we are here to just stimulate your immunity, not to create a dependency on the medicine. Your immunity is your whole and soul, which helps you recover from any issues in the body. So when we give a simple minimum dose with a single remedy, your immunity is boosted so that your body takes care of every complaint that you have. Say for example, many times we have a lot of issues, say like headaches, colds. Do you tend to take medicine every time? No. Many times we just leave it. Reason being, we know that the body has the capacity to heal. So in that case, what alternative ways do you take? You try to take something like a hot water. you'll try to use, say for example, eucalyptus oil, which will make you feel better. The moment you feel better, the cells of your body also say that, okay, we are on the recovery path. It's not always about taking medicines. It's about your thought that, okay, I am going to get well from this. I just need to make sure that I'm following few things which are more healthy. Okay. The fourth is drug proving. So in pharmacy, you have different ways of drug proving. You have the blind trial method. You have a double blind trial method, correct? In homeopathy, we had drug proving directly on healthy individuals because the source that came was from plants, was from animals, was from minerals. So we had to testify only on healthy individuals to study what exactly the symptoms are when we give you the medicine. The chronic disease theory. Not all the chronic conditions come from genetics. Many of the chronic conditions come because we keep on suppressing the root cause. We keep on ignoring the fact that there are things which are hampering your routine, which are hampering your normal body. So when you try to figure out why these chronic illnesses come, if you try to figure out what is the root cause of the complaints that you are having, it helps us to treat you well. So that is the theory of chronic diseases which homeopathy follows. And the last is theory of individualization. Everybody just take their hands up, like, I want to see everybody waving your hands. Are your fingers same? Look at each other and see if your hands are same. There is a difference, yeah? Every finger has a different height, different girth, different width. Just join each other's hands. Just shake your hands or just join them. Yeah? You see there is a difference, right? There is a difference, right? Then why do you give the same medicine to the patient when they come to you with headaches? I am having a headache. She is having a headache. She is having a headache. But when it comes to treatment with conventional medicine, they have only one option. What is that? A Panadol, right? How many of you here take Panadol frequently? Everybody, because you people study a lot, isn't it? Next day you have to wake up. So you see, that is the difference that we as homeopaths are following. That is theory of individualization. Not every person is same. Neither the immunity is same, neither the endurance is same, neither the capacity of a body to react to any medicine given is the same. Then why do we have same medicine for all diseases? That is where conventional medicine and complementary medicine differ, because we want to have a holistic approach when we are treating the patients. I'm just trying to brief in a very precise way. We are not here to say which medicine is best. Every medicine has its own perks. We have to follow what is right for us when it is needed. First, as we know, now I hope everybody knows who is the founder of homeopathy, Dr. Samuel Hahnemann. Second is, we don't have any side effects when it comes to homeopathy practice, and the recovery is natural and ideal. The sources of medicines, as we mentioned, they come from plants, minerals, and many more. And last, consider patient complaints at physical, mental, and social well-being, hence holistic. That is what the definition of health said, that the balance of your mental, emotional, and social well-being is a health. And that is where we as homeopaths try to focus. Now, fostering holistic approach, I need you to see the diagram. Now, when I say holistic approach, a lot of practices these days say holistic, but we need to understand what exactly the concept of holistic is. So, considering the patient as a whole, when we say, we are trying to take a detailed history with a root cause, its effect, its modalities, and triggering factors. Now, if you see the cycle here, say for example, time. First important thing, as a student or as a pharmacy student or as any individual, whenever anybody says to you, I am having a headache, how many of you really ask, like, what type of headache it is? We just say, okay, it's a headache, you have to give a Panadol. But as a holistic approach, you need to know since how long you are having a headache. Is the headache since last half hour? Is the headache since last 5 hours? Or is the headache since last 2 days? Get to know what the exact time of the complaint you are having. Second is which part. I'm just taking headache because it's more common. When you say headache, how many of we really consider which side of headache? Whether it is just right-sided, whether it is just left-sided, whether it is just a frontal area, whether it is occipital area. That is really important when it comes to holistic approach. Okay. Third important, how? Like, how did the headache start? Do we question that to ourselves also? No. How did the headache start is very important to reach out to what our root cause can be. Fourth is the trigger factor. Is there any factor that led to this headache? Was your sleep not well? Were you having stress? What led to this headache? Did you not have enough water? There are a lot of aspects that we need to consider when we are checking for one complaint. The reason being, we can get an answer from ourselves itself so that we avoid the episode of headache in future. We are not here to treat complaints just for a small period of time. You need to have the solution for a longer period of time. What is unique about the headache? You need to know what is a characteristic about the complaint that you are having. Is the headache one-sided? Is the headache associated with any other complaint in your body? Is the headache related to only your part, or is it related to your food habits, to your sleep habits? So every aspect is very important when we are trying to cure or when we are trying to give you a relief from the complaints. The most important part in homeopathy approach is the mind. Whenever you have a headache, do you feel okay? Mentally. You feel like hitting someone, isn't it? You feel like grabbing something and putting it on someone because the headache is so worse that you're not able to relax. So as much as it is important to treat the symptom headache, it is equally important to treat your psychological symptoms as well, because that is where your complaints can start reducing. If you have a relaxed mind when you're unwell, you are able to recover yourself within a safe frame period of 5 to 6 days. But if you're already broken down, you are not able to get that confidence of getting well, your recovery time is always increased from 5 to 15 days. Reason being, you are not relaxed, you're not confident, neither are you feeling that urge of getting well. So it really matters when it's a holistic approach that we focus on every aspect of the complaint. So when, where, how it happened is important for the case study to help understand the disease effect. It also includes the likes, dislikes, habits, characteristics of the patient before concluding the treatment in any condition, which we call individualization. Is there any query in this? Because this is the concept that differs from the conventional medicine. Any query? Let's discuss a case now. Like, I want this to be interactive. I want you to just consider that there is a 45-year-old coming to you and they are saying it's a chronic migraine. I want you people to give the symptoms of what can happen in a chronic migraine. Anybody, I want 5 symptoms of migraine that you can give me, because we are going to solve a case here so that we know that we are on the same page. So, yes. Persistent headache for days. Yes, perfect. Because it's a chronic condition, it has to be days. Persistent headache. Anyone else?
Blurred vision.
Blurry vision. Very nice symptom. What else? From this side, any symptom? Yes. Pardon me? Irritability, yeah. Very good symptom again. What else? I want 5. Irritability is noted. 2 more. Yes.
Altered mental state, confusion.
Confusion, yes. Irritability, confusion. What else? You have not touched another system of the body when it comes to migraine. There are few people who do tend to have that symptom. Yes. Perfect. Nausea. Yeah. So imagine when a patient is coming to you with these 5 symptoms. What is your take on it of giving treatment? Now he has said about irritability. He has said about confusion. He has said about nausea. What will be your consideration in terms of diagnosis and differential medicine diagnosis? What medicines would you give? We are not doing homeopathy right now because I know you don't know about the medicines, but what will be your role of treatment? What will you give? You study pharmacy, yeah? You're open to name the medicine.
I'd give an antiemetic
You'll give antiemetic, okay?
for the nausea.
For the nausea.
I'd give an a painkiller and an
Painkiller,
analgesic.
analgesic. Will you want to ask the person more questions? Hydration, okay. Okay, these three are okay. Anybody else apart from this, anybody wants to give anything else? How many of you want to question the patient more apart from this? You want to question the patient more on this? He is having a chronic headache. You have come directly to the medicine. Do you want to ask more questions? What questions would you like to ask more? Yes. You are having an? Perfect. How is your sleep pattern? That is the main thing. Any other questions that you want to ask? Yes.
What are the intervals from headache to headache?
Perfect. Intervals. What is the time when you are having headache?
Any stress that's broken?
Stress. Perfect. Any other question? So imagine when a patient is coming to you with a chronic headache, don't you think the case history should be taken in a better way rather than just coming to a conclusion of giving an analgesic or an antiemetic? Right? It's not that you will get that much of time with a patient when he comes to you or she comes to you. But it's very important to find out what is the root cause of the headache. When you say chronic headaches, how many systems do you have in the body? How many systems do you have in the body? Anybody can answer, even you can answer. How many of you really think that every system can be connected to your migraine? Do you think your gut system can be connected to your migraine? Yes? Do you think your bone system can be connected to your migraine? Are your bones connected to migraine? Yes, it is. Why? How many of you suffer from neck pain? Your cervical region, half of the time we are on the mobiles, yeah? The doctors have started telling you to follow 20-20 rule. Like just watch 20 minutes and then wake up and walk. Why? Because your cervical region is already affected. That presses the nerves, causing you a headache. How many of, like we have say around I think 50-50, yeah? How many of you girls feel your menstrual pains, your menstrual system is connected to your headaches? Yes? How many of you feel that your, what do we say? Your eyes are connected to the headaches. Your ears are connected to the headaches. Your throat is connected to the headaches. Your thyroid is connected to your headaches. Your constipation is connected to your headache. Everything is connected to your headache. This is just an example. Imagine we are just giving analgesic, we are just giving antiemetic. Can we just push ourselves a little bit more and try to find out if the chronic migraine was related to the lack of sleep or to the stress or inappropriate or insufficient absorption of the nutrients in the body, right? How many of you chew your food for 32 times? None of us, yeah? As per the science, they have said that you have to chew one bolus for 32 times. Only then the essential nutrients will be absorbed. But we don't do that, right? So definitely the absorption capacity of our body is not apt as described in the books. So imagine if your body is not able to digest the food properly, if you're not taking enough amount of water that is required by the body, how is your body going to reflect or how is your body going to respond? It might respond in a way of headaches, it might respond in a way of bloating, it might respond in a way of IBS. So the effect of what wrong we do is reflected by the body in form of symptoms, in form of disease. So as a responsible individual, not only for others but for ourselves, we need to have all the protocols for ourselves maintained so that we don't face any of these complaints, right? So this was just one case that we were discussing. So how many of you got an idea of there are so many possibilities when we are treating something, right? It should not be one way. When you're saying holistic, it has to come from every possible way. In that course, we always ask the patients, are you allergic to any food? Half of the time now I listen that people have turned vegan. They don't want bakery products. So for example, by mistake, if somebody is eating a cake and they have something put or added onto it, they will tend to have a headache, right? Are you sure of what you ate did not have the allergic product that you are? So a small thing can lead to a lot of things, right? So you have to be very observant when it comes to case taking. Only then, as a pharmacist or as a doctor, we will be able to give them a complete relief. Okay? Now, the third important point is the communication strategy. How many of you believe communication is the key to recovery? If you don't communicate properly, if you don't get to know what exactly the patient is suffering, the recovery will never happen. Why? Because you're going to miss out on the unique characteristics of what the patient can go through. So it's very important as a pharmacist or as a doctor that we listen more. We try to analyze more and find out what is the exact picture which we are supposed to treat. Okay? Any question on this one? We did a case discussion. I'm sure now everybody knows how to ask questions for migraine, right? So now when Ermias says I have a headache, you all will ask him questions? Good. So I've taken a case, like history of and a picture of migraine. Just a picture, reason being it sticks in your mind of how we are considering what are the common causes. Lack of sleep, hormonal changes in women, lack of meals, depression or anxiety. So we have considered every aspect, may it be mental, may it be physical or social well-being. Okay? These three factors constitute to help us know how we are going to treat patients. Okay? Is this clear? Now, I have been constantly saying homeopathy, homeopathy. How does homeopathy act? If before I put it ahead, I want if somebody can just guess like where homeopathy acts. I gave you like it's migraine, yeah? Where do you think homeopathy acts? You will not answer. Where does homeopathy act? Like I'm giving you the medicine for the treatment. You have come to me. We have been talking about migraine. Let's stick to that one. You are having a migraine. I'm giving you a medicine. I've taken a detail of all the history of how it happened, when it happened, why it happened, everything. Do you think that you will be able to answer this, like where homeopathy will act? Yes? Say it. There's no harm in saying it out loud.
Just guessing at the origin of the illness.
Origin of the? Very good. That's a very nice answer. Anybody else? You're really right. I admire the way you said it. Thank you. Anybody else want to say it? It acts on the root cause. So that is where the origin is. Just the synonym of root cause. Okay? So imagine you're treating the root cause. The problem is on the upper level and symptoms are reflected. Do you agree with this one? Isn't this how actually disease comes up? Right? And the second is it boosts up the immune system and builds up the resistance to disease. If we go back to the slide where I said that we use only a minimum dose. Say for example, now let us consider this tree. Do you think the trees need 1 liter of water? No. How much of water do they take, you feel? Depending upon the roots. They'll take only enough water that helps them to grow. Correct? And that is how our body is. We don't need everything in the body. We just need a little stimulation to our immune system so that our body takes charge and heals itself. So this is the concept of how homeopathy works. So the medicine also works on the nervous system by calming down the agitation one has during the disease. Like the way you mentioned, there is irritability, yeah, when it comes to headaches. So the medicine what we administer in homeopathy is not only going to cover your symptom of headache, but it will also calm down your nervous system so that the irritability is reduced and you have a complete cure. This was the concept of individualization. How many of you can see a similar one in that? Can you see a similar one? None are similar, right? None are similar? Or is there any one that is similar? Even if it is similar, the direction will be different. Is any one of it similar? None, yeah? Or is there any similar? There is? Where can I see? And which one? They're not similar. The direction is different. It's the perception of what you see. That's what is important as well. It's the perception. Okay, for you to just see. This one and this one is different because if you see their smiles, they are not same. There is the slightest difference. So the theory of individualization is what I see, you might not see. So that is how homeopathy differs. So for example, if I am having another colleague of mine who practices homeopathy, she might not see what I see. That is the theory of individualization. So it doesn't only restrict to patients, but even us as practitioners, we all will have different concepts of treating a patient. Say for example, when you said like migraine, you are having a headache, but the other one might having a headache and a vomiting, a nausea, right? So every person has a different perception, and that is how homeopathy differs with theory of individualization. Reaction of every person's body to same cause is different, correct? That is what individualization is. Do we all agree on this one? Like for COVID, how many of you got COVID here by any chance? Did anybody suffer from COVID? None of you got a COVID? You got? These two got? Okay. You also did not get a COVID? That's good. Even I did not get that for sure. Because we started taking the medicines that were meant to prevent and help boost our immunity so that we don't get infected. Maybe we got it, but it was not at that level which will take us to the hospital. So it was never a case that nobody got a COVID. Everybody got, but the symptoms were different. For example, few of them directly got consolidation of their lungs. Few of them got only cough. Few of them got only cold. So even during that frame of mind, we knew that we have to save ourselves, right? So everybody was responding differently, and that is how we stand as individual characteristics. Nobody is same, and hence the science of holistic approach. In homeopathy, you will never find the same medicine given for a same disease for different people. Everybody responds separately, differently, so we administer medicines according to your individual characteristics. This is a complementary model. Conventional medicine, complementary therapies, and patient-centered care. So the focus that we right now discuss was patient-centered. What the patient is feeling, what the patient is responding, how he will recover. Do we ask that when you're giving a Panadol? Do you consider when you give a Panadol of how the patient will respond? We are just giving a Panadol, reason being, okay, your headache will go. You'll get healed from the headache. That is the only ultimate goal, correct? But when it comes to patient-centered, when you give a Panadol, the first thing that should hit your mind is, I hope you don't get an acidity attack. I hope you don't get a side effect out of it. Make sure that you are patient-centered approach care. Okay? Don't be only symptom-centered. Let your approach, let your pharmacy work in a way which is patient-centered rather than symptom-centered. So these are the form of homeopathic medicines that we have. So homeopathy, as we all know, it was originated in Germany and then it was spread all over. It was one of those best practices in the 18th century where it was practiced in Pennsylvania. It had its own institute. They had their own associations till the 19th century when it was taken up by the other organizations. So we have liquid form medicines, we have tablets, we have cell salts, and we have mother tinctures and dilutions. So these are the form of homeopathy medicines that are used when it comes to healing patients. This is just a simple concept of how homeopathy works. As we all know, drug proving is done on healthy individuals, right? If you see, how many of you know pathogenetic factors? Meaning of pathogenetic factors, anybody? You don't teach them pathogenetic factors in pharmacy? You know, I want an answer from you people, then it's not going to be like only I am the one talking. Pathogenetic factors from this side, because they are already answering. Can you all answer a little bit? Pathogenetic factors. Yes.
Pathogenetic factors are organisms that might cause disease.
Simple way, very nice. The organisms, the disease causing factors, may be viruses, may be parasites. Okay? Those are pathogenetic factors. So if you see this, because this is mainly important when it comes to pharmacy classes, pathogenetic factors plus genetic predisposition. How many of you know that genetics play a key role when it's a disease? If your genetics are weak and if they are going to make it prone, you will definitely have a disease that follows in the families. Hence, we are always told about hypertension and diabetes, that you people have to take extra measures so that you don't suffer from it. Why? Because if there are any other pathogenetic factors, they will first attack the genetic predisposition and cause symptoms. If your immunity is low, it will reflect on your body. So these are two important things that we usually consider when it comes to recovery and knowing how the disease occurs in the body. First is the natural disease, where damage, reactions and adaptation is seen. Say for example, this is the symptom, this is the symptom, this is the symptom, yeah? Can you just say what symptoms can you see in this image? Say it out loud. What do you see in this one? Say it out loud. What symptom can you see? Abdominal pain. Okay. Here. It's a bit difficult, I know, today, but it's the chills. And this one. Banda hai wo. Let me just zoom it. He's anxious because he's biting his, isn't it? Now you got it. But you see, the perception of every person was different. Got it? So the symptoms are recorded in detail: mental, physical and emotional. So the last one was anxiety. That was a emotional taint. Okay? From a pharmaceutical research perspective, records subjective symptom profiles. How many of you believe in subjective symptoms? There are two symptoms, yeah? One is subjective symptom and the other is objective. Objective is something that is observed by doctors or you as a pharmacist. And subjective symptoms are patient feels. So we have to give importance to which symptom more? Subjective symptoms. Why? Because the patient is the one who is suffering. He will be in a better position to tell what exactly he or she is feeling. And on that, you as an objective person have to form an analysis of how it is going to go ahead. Now we are coming to a little bit of pharmacy part of how homeopathic medicines are prepared. As Mr. Emma, you told me that they are taught of how to make the medicines here, the traditional medicine, the herbal medicines. So when it comes to homeopathy, we have a serial dilution either with 10 or 100 drops of media like water with the source of medicine, that is plant or mineral. So we usually take 1 to 2% of the real source of the plant or mineral, whichever medicine the patient needs, and we add the media, either 10 drops or 100 drops, depending on what potency we want to give. Okay? And it is shaken very well, which we call succussion. It's vigorous shaking. Okay? And each dilution is believed to release the dynamic energy, considering the nanoparticles settling with a therapeutic dose. How many of you have heard of nanoparticles? These days, nanoparticles is coming into more of existence. More of research is being done because, as we mentioned earlier, a simple minimum dose can stimulate your body. So imagine if nanoparticles are used and we are able to help our immunity, it will be a revolutionary change where we will not be dependent on medicines for smaller issues or smaller diseases. Yes, when it comes to chronic conditions or acute conditions where you will need conventional medicine, we should not fail to reach out to them. But when it comes to nanoparticles, yes, there is a lot of research still going on so that we are able to catch the market and make sure that that is being used for us in terms of recovery. Different potency for different conditions as per the individual properties of the person and disease. In homeopathy, when we say that we are treating you with a single dose or a single medicine or with a minimum dose, it depends upon person to person and disease to disease which potency we will use. We have potencies right from 30, 200, 1m, 10m. So it's the dilution and it's the succussions that we keep on increasing, so that, as we mentioned about, the dynamic power is used to treat the patients. Last but not the least, ultra low doses may stimulate the body's response indirectly. So our main concept here is the minimum dose with a single remedy. That is how the preparation of homeopathy medicines is, and that is how we administer medicines to patients. Now let us just come to symptoms, because I know, like I've explained to you what the science of homeopathy is, but where all we can use homeopathy. We can use homeopathy in various types of pain, may it be arthritis or joint pains, tooth pains, renal pains, cramps, childhood colic. Because when you say pain, it can be anywhere in the body, right? Anywhere. But how many of you try to find out what is the cause of the pain? As we discussed about the case previously, that is how we are suggesting everyone to find out what is the root cause of the complaint, so that the patient gets a long-term recovery, a long-term action, a long-term effect, so that he doesn't face it again and again. Say, for example, we'll go to childhood colic. We have seen children growing, yeah? We have seen the children crying at night, crying throughout the day. And every time the parents or the elderly at the home say it's a colic, right? Why have they just stated it as colic? Has anybody questioned that? Why only colic? Because they don't answer, yeah? They're not going to say anything. But if you tell me, oh Shruti, you are having colic, that's the reason, it's the pain. Will I say a yes? I'll say no. I'll answer them back, no. I might have a pain because I'm not drinking enough water, I have not taken enough food. But for a child, when you say colic, it really becomes difficult because you don't get an exact answer. So you have to be very precise when it's a childhood colic. You need to know the history from the mom of how the baby is sleeping. Is the baby being fed on time? Is the baby having good activities, like is the massage done properly? Because all these natural things which don't need any medicines can be done at home and the baby can feel better. So if you are able to track down, even say for example, now coming back to arthritis or joint pains, not arthritis is like only for the elderly. We as individuals, even at the age of 20, 25, we do have joint pains, right? How many of you go to the gym here? How many of you go to the gym? Nobody? Okay. Oh, good. How many of you do your routine walking? Walking, yeah? If you say that you're not walking, you're lying, because even in this university, till the time I came, I did a lot of walk. So definitely you all are walking, right? After a heavy day, after a lot of work, how many of you feel soreness in your body? Everybody feels that. That is what we are calling pain. So if you know how you have to cope up with it, you will be able to treat yourself. How many of you take care of your intake of water? How many of you really think that you drink 2 liters of water in a day? If you are drinking, it's very well. It's very good. Those are the natural things that you can implement in your routine so that you don't suffer from simple symptoms or simple complaints. We are not here to just treat patients. We are here to find out solutions in a way that will help you to grow in a healthy way. Okay? So homeopathy is not always about treatments. It's always about holistic healing and holistic health. So the importance is given to where, that is the location, the type, how it is, the modality, and other associated complaints. So any complaint a patient comes with, may it be pharmacy, may it be disease, may it be conventional, you need to know these 4 things: where it is happening, how it is happening, what are the triggering factors, and what are the associated complaints. This is the holistic way of treating patients. So when it comes to kids, a little bit of different perspective that we follow. Pregnancy history and the mental state during the trimester. This is very important when any of the patient comes post-pregnancy to you or they want a treatment from us. Why do we have to go to the pregnancy history is, we need to know what are the hormonal changes that really affected the lady. What are the mental state that she was during all the trimesters. Was she really sleepy? Was she having any infection during any trimester? Was she able to do her routine activities? That gives you an account of whether she was healthy during the pregnancy. If the mother was not healthy during the pregnancy, there is a high chance that the child is also going to carry those symptoms with her. So this is very important. The child's reaction and milestones. Medicine easily absorbed. Okay, child's reaction and milestones is very important. The reason being, if you get to know that the milestones were on time, you know that the development of the child is going to be well. If the milestones are delayed, you need to be a bit extra cautious to know what the mother had during the whole of the pregnancy, whether her diet was not good, whether her diet was good. Everything accounts to make sure that the child is given good care and right care. The best benefit of homeopathy in kids is the medicine that is easily absorbed on the tongue. You have to just put either the small pills or the drops, and the baby doesn't even hesitate to take. We have a lot of kids that come to us and they are very happy when they take the treatment from us. This is one of the case that came to Mombasa to our clinic. It's a 5-year-old male child who came to me saying that I have a tummy ache. Imagine I'm just treating him for tummy ache. Do you think the baby would have recovered? Can anybody tell me what was the case of? I think it's quite visible. For the last benches, I can tell it was a case of gallstone colic. Imagine a 5-year-old child coming to you for gallstone. It came to me twice and the baby was just complaining, I'm having a tummy ache, I'm having a tummy ache. We felt maybe the baby is not taking enough water. We felt that the baby is eating a lot of wheat. We felt that the baby is taking a lot of cold drinks. Because you don't understand what exactly the baby is taking when it goes to school. Because he's a 5-year-old. After 2 weeks, when we saw that the pain is still the same, we asked him to get an ultrasound done, the investigation. The reason being, if the patient is not recovering even after your treatment, you need to step into few diagnostics so that we know that we are not missing out on something. And we came up that it was a 5.5 mm gallbladder stone that the child was having. The mother was reluctant to go to conventional practitioners because she was not ready for a surgery. We did explain to her that the 5.5 mm needs a diagnosis proper way, even from the conventional practitioners. But she was ready and she wanted it to be treated at a clinic. We explained her everything of how the medicines will act, how the course of treatment will be. If you see the date, she came to us on 22nd of May. We never told her like within a week or within a month the treatment will give you results. Reason is we are not giving aggressive treatment. We are not giving any medicines that will cause side effects. We studied the case in a holistic way right from her pregnancy history, where we found out that the mother was not taking enough water throughout the pregnancy. That was one of the causes. That was not the root cause. When we studied the patient also, the patient was not drinking enough water. Whatever he was eating, he was not chewing it properly. But we also found out that the hemoglobin was also less. It depends, like not all these markers will be same in another baby having a similar case or a similar stone. Everybody is different. And fortunately, with the treatment that we gave, in a span of 2 to 3 months, the gallstone was dissolved because it was only one. If it was multiple, as a complementary practitioner, I would have told her to go to the doctor to make sure, because having a gallstone, it can get stuck somewhere. It can cause more other issues to the child. But it was fortunate that a patient was recovered, and after treatment, he never had any gallstones. We are still in touch with the patient. The patient is from Mombasa. So this is how homeopathy helped the patient to get cured. Now simple other hair fall, skin complaints and homeopathy. So what are the common causes that we usually consider when a patient comes to us for hair fall, skin complaints? Is the stress. If it's a woman, we usually check for the hormonal imbalance. In general, we check for the work pattern, whether your work pattern is for 8 hours or 9 hours, or you're working round the clock for more than 12 hours. Exposure to sun, change of weather, and application of chemicals. So these are the common causes that we consider when any of the patients with these complaints comes to us. Now, considering the pharmacy point of view, when you people will be asked like which medicine we need to give, until and unless you are sure what is the real cause of it, don't try to treat anyone. The reason being, you will be able to treat only at a superficial level. Yeah, you need to find out what is the root cause of why the complaints are happening with the patient. There is another case of skin complaint. If anybody can guess what it is, I'll just zoom it so that you get to see. Anybody? I'll just give you a little bit of a history so that you're able to just guess what it can be. It's an anxiolytic disorder that has come on the skin. She used a lot of steroids to heal, but it was not happening. It's a rare one. Like, let me not take much of your time. It's lichen planus. Have you heard about it? So there are different skin diseases. One is like psoriasis, another is eczema. There's lichen planus. So this was a case of lichen planus that came to our clinic, and it's an anxiolytic disorder. I'm not saying a disease. If we say a disease, it becomes difficult for us to cure it. It's a disorder. Disorder means there is a chance that the skin can come back to normal. So the patient had a history and she was having anxiety issues for a longer period of time. She went on with steroid treatment, everything. She came at last to me, like after everything was done. Let me be honest, when it comes to alternative, homeopathy, Ayurveda, people will come to you at the last. You are never chosen as the first priority. Why? Because people want a faster, quick healing. That's the reason. But when they get to know that it is a chronic condition, it will take a while, then they're okay to trust you. So after, say, a course of like 4 to 5 months, the patient was completely healed and her leg looked like this. Why were we able to heal, do you feel? Because we found out the root cause. We made sure that her anxiety was the root cause of her complaints. She used to keep on scratching. This is a far better version of what I'm showing, the one that was with black spots with a white patch. She used to take a comb to scratch it. It is that bad. Like the anxiolytic disorders, when they come, they're really, really bad and they don't leave your skin early. This was one of those cases which we felt like it needs to be shared so that you people know the power of natural medicines, homeopathy medicines, Ayurveda medicines. They do have the power, but you have to be honest with your patients that it's not a one night thing, neither it's a thing that it will be covered in 1 month. Your body response depends on how you keep your body, how you're taking good nutrition, how you're giving time to that injury, how you're giving time to that condition. So it completely depends upon the patient of how he wants to recover. Here we are not debating on who does it best. We are trying to include this in the main course of medicine so that if there is a patient who knows that she is not getting well, she has an option of continuing with traditional medicine, with alternative medicine, or with complementary medicine. Now this is another one. How many of you go through this? How many of you? Because you're students, you have to go through this, or either you're using your TikTok or you're using your Instagram. How many of you use your phone till 2 o'clock at night just scrolling those reels? Don't you see the reels? You see, yeah? That is the reason you have these sleeplessness issues. Okay, so think out, what is the scope in sleeplessness if I want to treat you? Will I be able to treat you for your sleeplessness? Yes or no? How? If you decide to scroll on your phone every day night, how will I help you? You see, that is the main important thing. Self-analysis. You need to know why you are not having sleep. If you know the answer to it, what is the first take? You have to work on yourself first and then find out why the reason of sleeplessness. There are a lot of tests that are associated with sleeplessness. How many of you have heard of thyroid? How many of you know that thyroid issue is associated with sleeplessness? We often tend to forget that thyroid can lead to sleeplessness. What do we start thinking? Oh, There's a lot of stress on my mind. Oh, I think it is too hot in my room to sleep. Oh, I have a lot of things that I need to complete by next day. I have to finish my this thesis. So our main focus goes on what? Stress. That we are stressed, so we don't have enough sleep. But how many of us really look into ourselves and think like, okay, if my periods were not normal this month, that can be one of the causes that my sleep is not good. Oh, I did not have a good workout this month. I did not give enough training to my body. That is the reason my body is lazy and it's not allowing me to sleep. There are multiple things that one can actually ask ourselves and say that, okay, let me try to recover without even taking any treatment. When it comes to sleeplessness, a lot of my patients, I never give them treatment. I give them a reverse psychology method. How many of you can count 500 to 1 in a reverse order? 500 to 1. How many of you can? It's difficult, yeah? If I ask you to say 1 to 500, you will count it within seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, right? But I'm asking you to say, like I want you all to say 500 to, say 495. Come on, people say it fast.
499 for 98, 97, 96, 195.
You have to drain your brain, isn't it? To know. Okay, after 99 it's 98, 97, 96, 95, yeah? This is a method, a natural way of inducing sleep. Drain your brain. Try doing it. If any patient comes to you for sleeplessness and they ask you, oh, give me an anxiety tablet, I'll take one and I'll go to bed, right? Tell them, like for 1 week, try doing this. Count from 500 to 1. Trust me, patients fall asleep by the time they reach 400. This is the most natural way, and I've seen those results, and my patients are really happy because they don't want to be dependent on a medicine. But yes, if the sleeplessness has been for years, even in a week time a patient is not recovering, you need to refer that patient to a psychologist to understand why the sleeplessness. In spite of having all the thyroid and everything normal, if the patient is not able to sleep, you have to make sure that he goes to the psychologist to understand, are there any other changes that has happened? Okay, so important is, as much as we are trying to focus on complementary, we should not forget that conventional medicine has to go hand in hand when it comes to chronic or acute conditions. Okay. When did the faith in homeopathy go up? It was during the COVID epidemic. We saw the surge for the need of traditional medicines. During the forum, I think it was Tanzania, who mentioned that they have a council and they gave a lot of medicines, traditional medicines, to the public so that they don't get COVID. It was in Tanzania. Homeopathy was approved in India by the Prime Minister, Mr. Narendra Modi, under the Ayush Ministry as a preventive to boost immunity. There was a medicine called arsenic album, which went so viral that it was out of stock for months. People started taking that so that their immunity was boosted. But people started using it as a preventive. It was not a preventive. It was never a preventive. Because with homeopathy, we never say that, oh, you will not have a disease if you take this medicine. No, we are here to boost your immunity so that you don't get infected. Okay? There has been an official homeopathic physician treating the royal family since the 1930s. The Prince of Wales became the patron of a homeopathy group, the Faculty of Homeopathy, in June 2019 to support this alternative and complementary practice of medicine. To our knowledge, we were told that even in the last days, the Queen was taking homeopathy medicines because she wanted a peaceful recovery or a peaceful death, we usually call, so that there are no harsh effects of the medicine. I don't know how much true it is, but it was said that she was taking homeopathy medicines. Homeopathy medicine was given an official status in the 9th Asian Games in 1982, where it was given to the Indian contingent as a sports medicine. There are a lot of sports people who use homeopathy medicines as a sports medicine. One of them is David Beckham. If you see his book also, it's written that he uses Arnica montana as a medicine post play. And David Beckham, I know everybody knows him, right? Yes, so you will go and just put and see if David Beckham said that, okay? Now, important is the ethical and professional duties. As much as we all know about how homeopathy is, we cannot let ourselves just go because we know about the science. We need to follow the ethics and professional duties. Important is to have an informed consent from the patient, like the way you took an informed consent from me that you want to record me. Okay, the informed consent is very important. The reason being, homeopathy is a complementary medicine where you can assure results depending upon patient's response, not upon how you are treating. Non-maleficence, you cannot do anything wrong to the patient unless you have a complete knowledge about it. Don't give it to the patients. Avoid delaying life-saving therapy. If you feel looking at the patient that they need immediate care, do not delay the process. Make sure that they reach the doctor in time. Respect the patient autonomy, because when it comes to homeopathy or traditional medicine, we take a lot of history from the patients, including their psychological background, including their family history, a lot of things. You need to maintain that, because if you maintain the privacy of the patient, they are able to trust you more better. And practice within the regulatory guidance. As we mentioned, like we had the first ever East African Forum in Kenya, which was guided even by the WHO. We are forming those guidelines so that ever you want to practice, it has to go through the guidelines so that nobody questions you regarding why you are practicing and how you are practicing. It has to go through the guidelines. Even when we practice homeopathy in India, because I have practiced more than 15 years in India, we always followed the guidelines, we always followed the policies. And it's very important as a practitioner or as a medical student that we follow these guidelines. So the WHO guided rules under TCIM are already there. I think, Ermias, you have them, yeah? The WHO guided rules, you can share it with them so that you know how you have to practice. And working closely with the ministries for policies should be in place, which will give you the right and an authority to practice. Few other reviews from our patients treated at our center, like different, like she had an allergic cough, sleepless nights, and with the treatment, within a month, she was okay. There was another Mrs. Rosanna, she's from Mombasa, and I think we had a very holistic, different view with her, a different approach with her, because there were a lot of psychological patients that we came across in Mombasa, and that is how we treated them. Coming towards the end, I want you to have a takeaway message. It's up to you today to start making healthy choices, not choices that are just healthy for your body, but healthy for your mind. I hope this gives you a clear picture that we are not here to promote anything. We are here to educate so that you can decide and allow the patient to know there are these ways of practicing and healing. So all the very best to each and everyone here. If you have any questions, feel free to ask me. Thank you. Yes. Mm-hmm.
Maybe we can take that's the expected from the minerals, plants, animals. So how is the standardization?
So the standardization at the moment we are following is of the Ayush Ministry, that is from India, because it is standardized there. In Kenya, we are working on the policies. That is what we were discussing. We had the first ever East African Forum where we are including everything in the policies, because the standardization will depend upon what herbs you get in Africa. What we get in India are different. So definitely the standardization there is different because the environment is different. So the action of those medicines will differ from what we have here. Here we have a lot of traditional practitioners who have their own herbs, and I think it's in Uganda which has been approved because they have followed those standardization as per their ministry. Unless we have the ministry in hand with us, we cannot standardize it.
Yes, the last question is based on the approach explained that when a patient comes, you start with the lowest dose that's possible. So I asked what are the parameters that you maybe try to use so that you're able to validate that this is going to be the least dose that I'm going to administer to this patient.
Okay, so the 30 potency in homeopathy we consider as the least dose. Okay, but that 30 is used for pathological conditions, wherein if you are coming to us with acute condition, we use 200 potency. So depending upon the numbers, you might feel 30 is the lowest, 200 is the biggest, but it completely depends upon the state of disease that you are into, whether it's a acute, whether it's a chronic, whether it's a pathological case, whether it is just a psychological case. So depending upon the case, we decide which potency can be given.
Thank you.
You're welcome. Yes. Sorry.
Thank you so much, Doc, for your presentation. So I want to say that ever since we started doing this course of CAM,
Mm-hmm.
my the way I see things in pharmacy has really changed,
Mm-hmm.
and I would like to take a career in that path. So my question is, as a pharmacy student right now, how do I get into such a career? Because I would like to get into homeopathy or medicine, complementary medicine. So how do you get to there? When you graduate, like what happens? Yeah. Thank you so much.
That's a good question. But I think this will be a wrong platform for me to answer because, as Ermias also knows, like in Kenya at this moment, we don't have standardization done. Neither do we have anything that can hold the authority to allow you to practice this medicine. We need to have institutions, we need to have awareness programs, we need to have the trainings done so that you can pursue it. At the moment, it's not here. Yes. So I have studied it in India, which is approved there. Like I've done my bachelor's, I've done my triple master's in homeopathy, and that is the reason I can practice here. But I practice only as per the norms and guidelines given by the ministry to me. Also, as mentioned, when it comes to homeopathy, you need to be in a place where it is proven, where you get an exposure with the patients. We have trained ourselves in primary health centers, we have trained in hospitals where we have seen more than 5 to 6,000 patients during our internship, so that when the knowledge we get, or we try to know how our science will help the patient, we get a first hand knowledge. We have the mentors there who are also expert in homeopathy, and they help you to guide, and they will give you the right way of how to do this practice. We still have few practitioners here in Kenya who have studied at Kwale Integrated Science College. There are more, as I told you, more than 100 practitioners are here. They were taught the same basics and they were able to practice but not licensed. Currently, homeopathy, alternative medicine falls under Kenya Medical Board. So you have to have a license from them to practice. So if you ask me, you want to pursue, I would just recommend you to go through a course which will be accepted even in the other universities. Okay. Any other question? Yes. Just pass on the. Keep another there.
Okay, thank you, Doc. So my question is concerning the action. You say that everyone reacts differently to different medications. So how do people test, to be able to know this person will react differently to this medication and this one react differently?
No. So basically, if you see, I did mention about drug proving. It is done already on healthy individuals. So when we administer the medicine, we know how the body is going to respond. As physicians, we know how the body will respond. The drug proving was done on a healthy individual. Say, for example, we'll take the cinchona bark experiment. The name of the medicine is Cinchona officinalis in homeopathy. So, for example, if a patient coming to me has fever, he has chills, okay, I know if I'm giving this medicine to him, he will respond in the same way that I am expecting. I gave that for you people so that you understand that when you're giving a medicine, you need to know what effect it will give. That was for normal people, but if you are a pharmacist, you will already know that how the body will respond. Am I clear or not yet? Say it, we can discuss it so that you are at peace.
Okay. In this line, I thought about maybe saying if this person, if maybe the person is in pain, you're not going to give them paracetamol. You're okay, this one I need to give them ibuprofen. So I thought in that line, but I've now understood.
Say, for example, I was saying it in context where you will respond separately, she will respond separately. So as a physician, I need to know which medicine will help you more and her more. So diclofenac and paracetamol is something which is conventional. I will not be the right person to say it on that terms. But yes, if you ask me in terms of homeopathy, I have two medicines. Say, for example, I just said arnica, yeah? Beckham uses that because after the whole game, he feels soreness in his body and he uses arnica. But say, for example, Messi is there playing and he gets a tear in his ligament or an injury in his ligament because he has overworked that ligament, I will not give him arnica, because arnica is only for the soreness and the pain in the body. But as Messi has hurted his ligament, I have another remedy called ruta, which is used for injuries during sports. So I'll give him ruta because I know that when I give him ruta, the effect will be right. After giving arnica, the effect from the body will not be right. So these are two medicines. In spite of having a similar pain issue, I'm not giving them the same remedy.
So it's for the condition.
Yes.
Differences in the condition.
What is the cause? This one was just overwork and play. This one was on overstrain on the ligament. Both of them are having knee pains, okay, after playing. But one is having knee pains because it is overworked. The other one is having knee pain because he sprained or hurt his ligament. Now if I give arnica, he will just feel better in pain. But the action of the medicine or the effect that I am expecting from the body will not be the same. Is it clear or no? These are two medicines I gave.
Yeah, it's clear.
Symptom, you both came to me. Say for example, you both have come to me with pain. Just to understand for you. You have come with pain in your knee. You have come in pain on your knee. You played football. She played football. But you just came with pain. Now she's told me that I sprained my leg, my knee during the game. So I gave you one medicine but a different medicine to her. Why? Because the cause was different. Is that clear or not yet? It's clear?
So I think that is good, and I believe you all will be advocates so that there is an initiative by the Ministry of Health, as was explained, to have a policy to integrate it, and that is not from local. It all came from all the way from WHO. Now there are different guidelines which WHO prepared, and locally WHO is really advocating for a regional chapters for such practices and policies. So I believe you can be advocates when such communications, when such discussions are there, be keen to participate and to echo this message. So let us all appreciate Dr. Shruti for that
Thank
you. We have a small token of appreciation for you. Maybe Aquila Pride come. And you can you appreciate Quella Pride? She's the one who went on the way to bring this one.
Thank you so much for the
Thank you very
opportunity, and we look forward to have more sessions with these because they're quite interested. Yeah.
Very well, very well. Thank you. Thank you. Hope someone is taking a good photo.
Thank you.
Good. And also we have some gift for your colleagues. Please come.
Let me introduce so people know.
Yes.
So when my colleagues will come, they will introduce themselves to you, because that is also something that we try to follow in our clinics. It's not something that we are restricted only to homeopathy. So I like to introduce you and welcome Kiran. I want you to tell them what you do. Yeah.
Hello everyone.
चलो नहीं शायद से हाँ अभी चालू है
Hi, I'm Kiran.
नहीं बोले ना
Thank you. Can you hear me now? I'm Kiran. I'm an
I'm a
ABAT,
baker, but I try
Applied
to
Behavior
improve healthy
Analysis
foods,
Technician.
and if people need it,
So
we make sure that we
ABA,
work
that is
together.
Applied Behavior Analysis, we deal with behavior. We get to know why someone does what they do. And we inculcate the skill of skill acquisition. We reduce the problem behavior. We also deal with developmental disabilities like autism, ADHD. And I've also heard that in USIU, you already have ABA. I don't know if you guys are aware about it, but this course is already there. You can even talk to the students and get to know more about it. Thank you.
Thank you.
Thank you very much. I think I should come for that behavior analysis. I should come for that one. Thank you very much.
If you have problem behavior in your class, I think you should come.
Not for behavior problem. Is it only for a problem?
It is for other things.
तो बताना खाना भी अच्छा खाना चाहिए तो we make sure कि अगर डाइट प्लान बनाने तो we work around with that.
Someone is taking. Thank you very much.
Hi, I'm Survi.
हाँ आ रही है आवाज़.
I'm a baker and I make sure that I use healthy ingredients, and I also work on diet plans, healthy diet plans. So that's how we work together.
Thank you. Thank you. Good.
Thank you. Thank you.
Finally, let's have a group photo.
Yeah, we'll have a group